A ticking clock threatens millions of Americans with a sudden life-altering spike in health insurance costs, and the battle lines in Congress are drawn. At the heart of the dispute, should the temporary tax credits that slashed Affordable Care Act ACA premiums during the pandemic be made permanent? For Long Island residents, this isn't just a political debate. It's a fight over whether their health care remains affordable or becomes a financial burden. But here's where it gets controversial. Democrats and Republicans are clashing over whether these subsidies should vanish on December 31st, 2024, as originally planned, or be extended. And this is the part most people miss. The stakes aren't just about numbers on a spreadsheet. They're about real families, real choices, and real fears about what happens when coverage becomes unaffordable. The ACA's enhanced tax credits, introduced during the pandemic to help Americans navigate the crisis, have become a lifeline. These credits allowed millions to pay significantly lower premiums, with income-based subsidies covering up to 95% of costs for eligible individuals. But Congressional budget analysts warn that extending these credits would add $40 billion annually to the deficit, totaling over $300 billion by 2034. Critics, like House Budget Committee Chairman Jody Arrington, R. Texas, argue the policy was always meant to be temporary. They were a safety net for a crisis, not a permanent solution, he insists. Yet supporters, including Senator Kirsten Gillibrand, DNY, counter that these subsidies are saving lives. These credits are non-negotiable, she declares, urging Democrats to include them in any funding bill passed this fall. The political theater is intensifying. Senate Majority Leader Chuck Schumer, DNY, has hinted at risking a government shutdown to force Republicans to negotiate, while House Speaker Mike Johnson, Republican of Florida, dismisses such threats as Democratic posturing. They're desperate, Johnson quips, linking the debate to broader GOP frustrations over declining approval ratings and political instability. But cracks are emerging in the Republican line. 11 moderate House Republicans, many in competitive districts, have already backed bipartisan legislation to extend the credits for another year. Even Long Island's GOP representatives, Reps Andrew Garbarino and Nick LaLota, are quietly signaling openness to compromise. Our focus is on ensuring people don't lose insurance, Garbarino says, echoing a growing concern among GOP strategists that voters might punish them for repeating past healthcare controversies. The numbers tell a stark story. In New York, over 1.7 million people rely on these subsidies, with premiums set to jump by an average of 38% if the credits expire. For Long Island's 250,000 enrollees, that means an average $115 monthly increase for individuals and $228 for couples, a financial shockwave for families already grappling with inflation. We can't let people face thousands in premium hikes, argues Representative Tom Suozzi, D. New York, a co-sponsor of the extension bill. Yet Republicans remain unmoved for now, with Senate Leader John Thune, R. South Dakota, insisting that any short-term funding bill must stay clean of contentious provisions like tax credit extensions. So where does this leave us? With a September 30th deadline looming for a spending bill to keep the government running, the path forward is murky. Democrats are building public pressure, urging insurers to warn enrollees about potential premium hikes, while Republicans dig in. The question isn't just about policy, it's about priorities. Should Congress protect affordability at the cost of fiscal responsibility or uphold budget discipline, even if it means higher costs for millions? We'd love to hear your take. Is healthcare access worth the trade-off in deficits, or does fiscal prudence demand sacrifices in coverage? Share your thoughts in the comments below.